Thank you for watching My News 26. I'm Paula Jasper. Today we're in Traverse City. I'm at the Munson Medical Center. And joining me is bleeding disorders nurse practitioner Michelle Whitcop. Thanks for joining me, Michelle.
Hi, Paula.
Now, we're going to talk specifically about hemophilia today. Some people may have heard that term and they're not really sure what it is. How would you describe it?
Hemophilia is actually when somebody is born without a certain clotting protein. And specifically for hemophilia A, they're missing a factor VIII protein. For hemophilia B, as in boy, it is a factor IX protein. Hemophilia A is more common, and hemophilia B is less common. So for hemophilia A, it's about 1 in 5,000 births, and for hemophilia B, it's about 1 in 25,000 births.
Now, what does this condition cause to happen?
Well, it depends upon the severity of it, actually. For those who are severe, meaning that they basically have none of the factor VIII or factor IX, they can have spontaneous bleeds. For no reason at all. They will suddenly get a bleed in a joint, so a knee or an ankle, or they'll suddenly start to bleed in their head. So it's really a very life-threatening disease. And often it's diagnosed because at birth they will start bleeding after circumcision or after a heel stick, and it just doesn't stop bleeding. It's not that when they cut themselves they'll spurt blood out, but what happens is that internally they just won't be able to clot, and they can't stop bleeding.
Now, how is it treated?
It's treated with what we call a clotting factor. And years ago, probably in the 70s, early 70s, we were able to pull out of human blood when somebody was able to donate blood. We were able to pull these clotting factors out of that and freeze them and make what we call a factor product.
Now, I know that your telemedicine program is playing a big part in this.
We do. And because this is a really uncommon disease, so, 1 in 5,000 or 1 in 25,000 births, it's what we call a subspecialty. So finding especially adult hematologists that work in this area is very difficult across the United States. We do what we call comprehensive care. We sort of cocoon that child, that family, so that we can help them have as least problems throughout their lifetime, make sure that they're treated as best as we can, that they get a great education, that they have a great life. And we do that through the comprehensive care model. And generally that is led by a physician, nurse or nurse practitioner, medical social worker, and a physical therapist. But because it's so hard to find those adult providers, what we have done here at Munson Medical Center is to develop a telemedicine program. And you can see our unit right here. We connect via, some people might think of it as Skype, but it's what we call HIPAA compliant, in that nobody can hack into it and hear our discussion or, watch what we're doing. And we connect with our adult provider, adult physician down in the Detroit area. He's at the Karmanos Institute in Detroit. He's able to do consultations with our patients here at Munson and Traverse City. So they don't have to take those 2 days off from work. They don't have to travel that 250 miles or wait that 2 months in order to get to see him down there. They can see him usually within a couple of weeks if we need to get in that quickly. But we try to do diagnostics and everything ahead of time. And then we can implement the treatment plan locally, wherever they live.
So despite being a serious disorder, people can go on and lead normal, healthy lives, correct?
Yes, they can. And because of our current supply of factor, the fact that it isn't plasma-based, it's now all recombinant based in sugars, they don't have the disease transmission anymore, and our boys are leading normal lives by treating on a regular basis with a recombinant factor product.
Now, if someone would like information on this or other bleeding disorders, how would they find out?
Well, certainly they can give us a call. We have a website through Munson Medical Center, but easiest is just to give us a call.
Thanks a lot, Michelle.
Thank you.
Paula Jasper in Traverse City at the Munson Medical Center.